Thalidomide was a drug that was given to treat cancers. It was also given to women who were suffering from morning sickness in European countries. Women who took this drug during a period where fetal limbs were differentiating in the first trimester subsequently gave birth to babies with limb buds and not full limbs. This drug at other times wouldn't have had such tragic consequences. Generally, aspirin isn't recommended during pregnancy unless you have certain medical conditions. Low-dose aspirin, such as 60 to 100 milligrams daily, is sometimes recommended for pregnant women with recurring pregnancy loss, clotting disorders, and preeclampsia. Higher doses of aspirin pose various risks depending on the stage of pregnancy. During the first trimester, use of high doses of aspirin poses a concern for pregnancy loss and congenital defects. Taking higher doses of aspirin during the third trimester increases the risk of premature closure of vessels in the fetus's heart. The use of high-dose aspirin for long periods of pregnancy also increases the risk of bleeding in the brain of premature infants. Nicotine constricts placental blood vessels, temporarily depriving the developing fetal brain of oxygen and depressing the respiratory system. And fetuses are at risk of problems during both the pregnancy and after. Caffeine is found in coffee, teas, and soft drinks, and is linked to higher heart rates in neonates during both quiet and active sleep. It's not associated with birth defects or damage to the senses. Cocaine is a drug that blocks the serotonin, increasing these levels in the brain. This transfers easily from mother to fetus. Prenatal cocaine abuse and increases the rates of spontaneous abortion, stillbirth, abruptoplacental, which is when the placenta detaches from the uterine wall early, reduced gestational periods of up to 15 days, and low birth weights. The long-term effects are moderate intellectual and language defects. Cocaine and other drug abuses are understudied in our field. Heroin. Babies born addicted to heroin will have withdrawals within 1 to 3 days after they're born. This includes tremors, irritability, vomiting, diarrhea, perspiration, and sleep disturbances. Mothers are often weaned onto a methadone or oral supplement. This reduces the chance of infection of HIV and needle sharing. Babies will be born addicted to methadone and will have withdrawal symptoms 7 to 14 days after birth. The same process will be as that of heroin. Using heroin during pregnancy is associated with lower IQ potential, behavior problems, and insecure disorganized attachment.